In this video, we're going to talk about how to differentiate the various causes of hip pain. We get questions all the time about this. We get people reaching out asking us if we can help them with their hip pain. But the first step for you or for us as a practitioner is to understand where is it coming from exactly so we can actually treat it properly. My name is Dr. Todd Pickman. I'm the clinic director of Gonstead Spine and Wellness here in Meridian, Idaho. Let's dive into it. All right, this next cause of hip pain is referred pain coming from the spine. All right, so spinal nerves, those nerves that come out in between the bones, they turn into what are called peripheral nerves. And then those nerves go all throughout the body. And there's certain points in the leg, for example, on the skin. These are called dermatomes. You have them in the arms and the legs, all over the body. But right now, since we're talking about the hip, we'll talk about dermatomes for the lower extremity or the hip and the leg. And you can see that it's labeled there on the leg and it says L1, L2, L3, and they're different colors. That's showing that those are patterns of control on the skin and that region of the body that are directly controlled by the nerves that come out of the spine. So if you have irritation to the nerve of the spine, whether it's a subluxation where the bone shifts, the disc swells, the joint swells, it irritates the nerve, and that can be helped with a specific chiropractic adjustment in a lot of cases. Whether it's a disc herniation, those also can be treated conservatively in a lot of cases. Sometimes when they're severe, they need more advanced care. Sometimes they're even surgical cases, but we always try to start this conservatively first and really exhaust that before jumping into something like surgery. Looking at those patterns, understanding that, knowing that sometimes hip pain, quote unquote hip pain, is actually referred pain from the spine. And then spinal subluxation, like I was saying a second ago, the bones in the spine can shift, the joint gets stuck, and then it loses the ability to move properly. So the joint gets swollen and irritated, just like if you sprain any other type of joint. Subluxation is technically a sprain of a spinal joint. The joint swells, that swelling stays in there. Oftentimes, there's multiple areas in the joint that can swell, but the disc can be involved. Other areas around that spinal joint can be involved, and the swelling is what irritates the nerve and causes problems and causes symptoms. Pretty much stops that communication from happening at 100% from the spinal cord and nerve going out to wherever the nerve controls. So whether it's a muscle or parts of the skin or even organs and other systems in the body, that's why chiropractic looks at overall health as a very important thing that can be affected by nerve function. So nerve function affects overall health. That is a physiological fact. That is not a chiropractic thing. We just happen to pay close attention to that factual relationship. So disc herniations can refer certain pain from severe spinal nerve root compression. That can cause some pretty common pain patterns, and degenerative arthritis. So as a joint breaks down, that can also cause problems with the nerve and activate other referral patterns into hip or what someone thinks is hip pain. Okay, so there you have it. That is a breakdown of the different causes of hip pain. We covered almost everything out there. There's probably a couple others that I didn't cover, but if you have any sort of hip pain, or you know anyone that has hip pain, or if anything that you watched in these slides intrigues you as far as just wanting to get a full comprehensive spine workup, you can reach out to us. Our clinic's Gonstead Spine and Wellness. Our contact information will be below. And when it comes to the health of you and your family, results matter most. Thank you for watching. Make sure you subscribe, like, and comment. We appreciate you watching, and we'll see you on the next video. Video presentation by Meridian Gonstead Spine and Wellness of Meridian, Idaho. Our practice is dedicated to people suffering from neck pain, low back pain, tension headaches, migraine headaches, herniated discs, and leg pain such as sciatic. We have treatment protocols for musculoskeletal aches and pains, joint pain and dysfunction, and whiplash injury. Gonstead Spine Wellness offers a distinctive chiropractic experience. It is the only office in Idaho with digital motion X-ray technology. And this advanced imaging tool, combined with the Gonstead spinal analysis and necessary radiographs, enables precise identification of spinal issues. We provide safe and effective Gonstead adjustments, corrective care through chiropractic biophysics to enhance and sustain proper posture, and a 12-week transformation program. This program includes access to a comprehensive video exercise library for ongoing home support, ensuring long-term health and wellness. Call us at 208-888-6077, where results matter most.